In medicine, always and never does not exist. Through the science of simulation, scenario architects craft carefully researched experiences that expose this inexplicable truth, preparing clinicians to save lives even in the most challenging circumstances. The edifying discipline of simulation in healthcare transcends former instructive boundaries. It is remarkable when education and clinical practice can intersect in such a meaningful way. The 2022 simulation competition teams are dazzling emergency medical services professionals with immense grit and talent. All the competitors are dedicated to pursuing clinical and communication excellence as evidenced by months of preparation, practicing simulation to improve their clinical decision-making skills under pressure.
We'll go into the simulation lab to do hands-on skills with airway trainers and even make into some games, kind of an airway version of horse, if you will.
To prepare for the simulation competition, it's really about building a rapport with your partner. It's maintaining command presence and professionalism. In all the years of competing here at the simulation competitions, I've learned, I've grown as a provider.
Just keep counting. One, two.
It's going to be okay?
Though every competitor is a winner, 3 forward-thinking BLS and ALS crews advanced to the finals in a starting field of 24 teams. The capability to make a prompt decision that opposes a widely accepted norm authenticates a team that communicates well under pressure and possesses the clinical insight to solve complex medical dilemmas. Crews responded to rural New Jersey for a pediatric cyclist struck by an impaired driver. The extended entrapment time of the cyclist resulted in pelvic crush injury syndrome, a condition marked by acutely lethal high blood potassium. Immersed in the predicament of opposing the usual choice to move quickly in trauma, the winnable option to stay and manage the case on scene propelled teams to the finals. In the finals, the landscape took on a new look with Live Sim New Jersey, a simulated live broadcast studio co-anchored by Cronin and McCabe. Besides offering entertainment value to the overall experience, the co-anchors discussed each team's thought processes during the scenario. In the finals, competitors responded to a university setting during rush week where 2 partygoers knowingly ingested xylazine for an extra kick to their intoxication. Contestants found themselves navigating a wild frat scene where the winners managed 2 patients with a polypharmacy overdose and a 3rd complex cardiac patient due to a long battle with SUD. Substance use disorder affects all walks of life. There are no boundaries. It could be anyone. Treating all patients with respect and compassion and moving towards a solution to the substance use crisis facing our world is essential. EMS clinicians that maintain a non-judgmental approach to patient interaction position themselves best to help patients at risk of this dreadful disease. From the staff that worked so hard to make this competition possible, we thank you one and all for your participation in this year's competition and for your dedication to improving healthcare safety.